Hi guys, welcome back. If you've ever opened a medical bill and felt your chest drop, this video is meant for you. Most people think the hardest part of healthcare is the diagnosis, but the truth is, families experience the most trauma once they get home from those visits. When bills, denials, and all of the confusion begin. I realize my channel is newer and some of my viewers may not have ever heard of a patient advocate. So today I'm going to explain what that role entails and why you might need that type of support in your life. Here's the tale as old as time. Patient goes to the hospital, you're told that everything's handled, and then you go home. Then a few weeks later, bills start arriving, the insurance denies something, and the costs just aren't adding up. Then when you reach out to someone, they say, "Oh, call billing." Then billing inevitably says, "Call your insurance company." Then at times, insurance says, "Call your doctor. They'll figure it out." Suddenly, you're trapped in this time-consuming loop where all parties involved just refuse to take responsibility. But you're expected to pay the bill, and that bill isn't going away by itself. This is where most people feel overwhelmed, frustrated, and just overall defeated. Not to mention, many patients feel embarrassed or uncomfortable asking questions about these things. A patient advocate is a person who sits with you in the chaos, and they don't leave until you have actual answers. No more guesses, not a runaround, not a scripted customer service line, but actual answers. A patient advocate works for the patient, not the hospitals, not the health insurance companies. What do they actually do for you, though? So, patient advocates provide a wide range of services depending upon what their preference is and what they are best at. But generally speaking, they often break down medical bills line by line. They catch billing errors and duplicate charges. They help you appeal denied insurance claims. They track prior authorizations. They communicate between your doctors and your health insurance companies to serve as a liaison. They help find financial assistance programs when available. They assist families in understanding their coverage benefits before procedures. They support caregivers during long hospital stays that can be mentally and emotionally taxing. And they help patients make informed decisions inside a system that rarely explains itself. In simple terms, doctors treat your body, but patient advocates protect you from the system that surrounds that care. Why does this matter so much? Here's something people don't talk about enough. A single paperwork error, a missing authorization, or a mislabeled hospital stay can turn into thousands of dollars in preventable debt. And the scariest part, most families pay these bills not because they're correct, but because they feel afraid, confused, or exhausted, and they don't have somebody to step up and advocate for them. So who needs a patient advocate the most? Patient advocates are especially powerful for individuals like caregivers, people with chronic illnesses, seniors, families of children with complex medical needs, cancer patients, and anyone managing multiple specialists. But basically, patient advocates are good for anyone who's ever felt alone trying to manage healthcare paperwork while also trying to survive the actual illness. You shouldn't have to become a medical billing expert just to survive a hospital visit. You shouldn't have to spend hours on hold with insurance companies while you're in pain, and you shouldn't be made to feel stupid for asking questions about money that you're being asked to pay. This is exactly why patient advocacy exists. If this video helped you understand the system just a little better, that's the entire point of this channel. You deserve to walk into healthcare informed, not intimidated. And if you're currently overwhelmed with a bill, a denial, or medical paperwork, just know this: you don't have to fight the system alone. In my next video, I'm breaking down ER versus urgent care versus primary care, and how choosing the wrong one for your care can cost you thousands of dollars. If you'd also like to follow me on X to get more healthcare tips and tricks, you can find me at @_health_hopeful. Thanks for watching. Bye-bye.